On to this conversation now. September is National Oral Health Month, so time to pay extra attention to your dental routine. As part of good oral health awareness, individuals are asked to prioritize their oral health, embrace regular dental checkups, and cultivate comfort in visiting their dentists. Dr Bongiwe Nhlangulela, many call her Dr. B, says as a family dentist, it's her mission to promote good oral health. She joins me now for more and to chat about Oral Health Month. Good evening to you, Dr. B. Thank you very much for joining us here on Newsnight.
Thank you so much for having me, Abigail.
My absolute pleasure. So it is Oral Health Month, so it's important for us to have these conversations. Let's just talk about the importance of oral health when it comes to overall healthy well-being and a healthy lifestyle.
A lot of people have left oral health to the side when it comes to general health, but it is absolutely fundamental in your overall health. A lot of the time people don't realize that things that are happening in your mouth give us a very good indication of what's happening in the rest of your body and vice versa. So it's not something to be left unsaid that your oral health is definitely fundamental to your overall health.
And should be prioritized.
100%.
So let's talk about establishing healthy habits when it comes to oral health. What is the routine that we should be taking? Is brushing your teeth once or twice a day enough?
The correct number of times to brush your teeth is twice a day for 2 minutes. I always speak about the rule of twos. So brushing twice a day for 2 minutes and visiting your dentist at least twice a year. Once you get that into your routine, and especially important from a young age, it's something that just becomes part of your life. But I think a lot of people, what they miss is doing it correctly. So people don't take the time to, they just brush, but they don't brush for 2 minutes. You know, so you miss some spots, and food doesn't miss any spots.
Yeah.
So.
So I've often heard that there is a correct technique. Should it be in circles? Should it be left to right? Should it be up and down? Or do you incorporate all three? What is the proper technique when it comes to brushing your teeth?
So the proper technique of brushing your teeth is making small circles on all the surfaces of your teeth. It's almost like washing a bowl. You want to wash it on the inside, and you want to wash it on the outside and underneath as well. So you want to make sure that you're brushing on the back, on the top surface, and on the front surface, and not focusing solely on one place. But the most important thing to remember is to be gentle. See a lot of people that brush way too hard because they think the harder you brush, the better the clean, and that's not true. And also to remember to also clean your tongue. You know, that's also part of your mouth, as well as to use the correct brush size, and also to use a soft bristle brush, because you don't want to wear down your enamel. It's very protective. The white part of the tooth is actually very protective to the insides of your tooth. So as soon as you brush that too hard, you wear it down quicker, and then you start to expose your teeth to things like sensitivity, and you're more predisposed to cavities as well.
Sure. So let's chat about the toothpaste that we should be using briefly. There are so many options for sensitive teeth, for teeth whitening. How do you know that the toothpaste that you're using is the right one for you?
So basically you want to have a look at what your oral health needs are. So if you do have sensitive teeth, then you want to try different sensitivity toothpaste. And I say different because not everything works for everyone. So if the one brand doesn't work for you, you'll try another brand. So the most important thing for me in a toothpaste is that it has fluoride. And for children, it should have less fluoride. So that will be on the packaging. Use age-appropriate toothpaste. But fluoride is my header when it comes to toothpaste.
Let's expand on the topic of children's dental care. A colleague of mine was actually speaking to me earlier and said the struggle of her young niece not wanting to brush her teeth. How do we train you know, young children about the importance of taking care of their teeth, and maybe some tips to get them to get into some sort of routine?
Well, without having kids, I'll do my best. I always say for children, you lead by example. Children always seem like they want to do what the adults are doing. So if you are doing the right thing, they're most likely to follow suit. So do it with them. So they must see you practicing good oral care. Take them to the dentist with you, even if they're not ready to be in the dental chair. It's all about normalizing and desensitizing them to scary things and to things that they don't want to feel like, don't make it a chore. So make it fun. I mean, play a song that lasts for 2 minutes. Some children look forward to that moment. It's actually a nice moment. You know, I see a lot of people on social media sharing hair moments with their children. And it's kind of the same thing. And once you start them young, it's just something that is built into their life for forever.
Yeah, that's actually a really cool tip. Let's talk about, you did mention that you should see your dentist at least twice a year. But a lot of people have this thing where they are terrified of going to see their dentist, dental anxiety. Yeah. Let's talk through that, maybe where that stems from in your experience when engaging with your clients, and how do we push past that? I
always hear patients speaking about previous experiences, normally traumatize them. I think the oral cavity is a very personal space for people, and so once you've gone through some trauma, you tend to have this fear that basically becomes a barrier to you seeking oral care, which is so counterproductive, because without a dentist, you also can't have a really healthy mouth. So basically what they need to do is they need to face their fears. Okay, you need to be a little bit brave and find a dentist that is right for you. You need to speak to your doctors more and tell them how you feel and tell them what you have had issues with in the past. And I hope you find the one that, you know, sort of cultivates that comfort in the dental chair for you.
100%. So, as mentioned earlier, September is Oral Health Month, and your practice is having free screenings throughout the month of September, if I'm not mistaken. Just talk us through that process and that campaign.
So basically, we've done this for the last couple of years now, and what we want to do is really bring people in, because dentistry is not what it used to be anymore. I have a lot of fun with my patients in the chair. A lot of the time it's very little about the dentistry and more about the relationship with the individual.
Love that.
And so bringing them in and just having a chat with them, having a look in their mouth and just letting them know what's sort of happening, sort of gives them a little bit of it kind of breaks the ice in terms of them then seeking dental care. So the point of the screening is just to give you a sense of what's going on in your mouth and encouraging you to seek dental care. And hopefully it's something that you subsequently prioritize.
Yeah. Just lastly, something that's been trending for some time is teeth whitening. And there's different procedures, there's different processes. Some of it seems quite painful. Let's talk about the process of teeth whitening and what the different options are perhaps, and should it be as painful as some people experience?
So teeth whitening will never go out of fashion, because people associate healthy teeth with white teeth. But really, there's many different options, and not everyone is a candidate for all the options. So it's important to speak to your dentist about, you want white teeth, and they must sort of understand what's happening in your mouth in order for them to design a whitening plan for you that works. Unfortunately, one of the most common side effects of tooth whitening is transient sensitivity, which means it doesn't last forever.
Okay.
But it can be quite an adjustment, especially for people. Normally people who qualify for tooth whitening in the chair are people with really healthy teeth, and so they're not used to having dental problems, and so that little burst of sensitivity is quite a shock for them. But it does go away, and there are other options if you suffer from sensitivity, like whitening at home. The only thing I always say to my patients is, I personally don't believe in a lot of whitening toothpaste.
Okay.
Because of the mechanism in which they whiten your teeth. They sort of scratch your teeth more, which goes back to that abrasion of the enamel and predisposing you to sensitivity in the long run. So definitely I would only either buy my product from my dentist or do the whitening in the chair.
Okay, got it. Dr. B, thank you very much for your time. Thank you for sharing your insights. It's been lovely chatting to you. And I must say, it's lovely to see a young woman at the forefront of dentistry in South Africa. It's so exciting, and I wish you all of the best in your journey.
Thank you so much, Abigail.
My absolute pleasure. Well, that was Dr. Bongiwe Nhlangulela. She's known as Dr. B, and she's a family dentist, just chatting to us about the do's and don'ts when it comes to our oral hygiene as we observe Oral Health Month this September.